Welcome to the podcast. My name is Dr. Noor Gajraj. Let's talk about understanding low back pain, causes and injection treatments. Low back pain is a common condition with a variety of potential sources. These can include structural issues with the vertebra or discs, inflammation of the joints, or muscular problems. The spine is composed of vertebra separated by intervertebral discs and supported by a complex network of muscles, nerves, and joints. Pain can be localized or can radiate to the hips, buttocks, or legs. Diagnosis often involves a physical examination, imaging, and sometimes diagnostic injections to pinpoint the source of pain. Lumbar disc disease. This condition involves damage to the intervertebral discs, often leading to compression of a nerve root. Key symptoms: pain that is often worse when sitting. The L4, L5, and L5S1 discs are subjected to the greatest compressive forces. An L4, L5 disc herniation can compress the L5 nerve root. An L5S1 disc herniation can compress the S1 nerve root. Pain may be accompanied by radiculopathy or sciatica, which is a radiating pain, numbness, or weakness. Injections: lumbar epidural steroid injection. Steroid and anesthetic are injected into the epidural space around the spinal nerves. Caudal ESI, used for patients who have had previous back surgery. Transforaminal ESI, used for unilateral, that's one-sided pain, by injecting the medication closer to the effective nerve root. Facet joint disease. Facet joints connect the vertebra and can become arthritic, typically in adults over 50 years old. Key symptoms: paraspinal tenderness, pain on extension, which is leaning backwards, and rotation of the back. Changes in facet joints can be present in up to 10% of asymptomatic adults, highlighting the importance of correlating symptoms with physical findings. Injections: facet joint injections, a diagnostic and therapeutic injection of a local anesthetic and steroid directly into the joint. If the pain is decreased by 50% or more than 6 hours after the injection, the patient may be a candidate for radiofrequency ablation or rhizotomy. This uses heat to lesion the medial branch nerves, blocking pain signals from the joint. Sacroiliac joint disease, inflammation or dysfunction of the sacroiliac joint, which connects the sacrum to the pelvis. Key symptoms: acute onset, often following an event like stepping off a curb or lifting a heavy object in a twisted position. Pain radiates to the hip, back, thigh, and can extend as far as the knee. Pain is aggravated by all hip and twisting movements, climbing stairs, bicycling, sitting, and lying down. Tenderness is localized directly over the SI joint. Injections: sacroiliac joint injections. A steroid and anesthetic are injected directly into the joint space to reduce inflammation and relieve pain. Spinal stenosis, a narrowing of the spinal canal or the neural foramina, which are the openings where nerves exit the spine. Key symptoms: back pain that radiates into the buttocks and lower extremities. Neurogenic claudication, pain, tingling, or weakness in the legs that is exacerbated by standing, walking, or extension of the back. Pain is typically relieved by lumbar flexion and/or sitting, which opens up the spinal canal and can relieve pressure on the nerve roots. Injections: lumbar epidural steroid injections, similar to the injections for disc disease. These injections are used to reduce inflammation and swelling of the compressed nerve roots within the spinal canal. Piriformis syndrome, a neuromuscular disorder caused by the compression or irritation of the sciatic nerve by the piriformis muscle in the buttock. Key symptoms: buttock pain, tenderness over the piriformis muscle. The pain is often mistaken for sciatica, but the source is muscular irritation rather than a spinal nerve root issue. Injections, piriformis muscle injections. A steroid and/or an anesthetic is injected directly into the piriformis muscle to reduce inflammation, relax the muscle, and relieve pressure on the sciatic nerve. Myofascial disease. This condition involves pain and inflammation in the fascia, which is the connective tissue, and muscles. Key symptoms: pain in discrete muscular and fascial trigger point areas. Trigger points are tight tender knots within the muscle that can cause pain both at the site and in referred areas. Injections, piriformis muscle injections. A steroid and/or an anesthetic is injected directly into the piriformis muscle to reduce inflammation, relax the muscle, and relieve pressure on the sciatic nerve. Thank you for listening. Please consider buying my book, 100 Pathways to Longevity, and subscribing to this channel. Thank you.